So my biggest wish for you, if you're out there and you are like many of the stories I've heard in my practice of patients that feel that something is wrong with them because they had a painful egg retrieval and they just don't feel they can do it again. Know that there's nothing wrong with you and that there are sedation protocols available that can actually make most patients, if not all patients, very comfortable. That's an option for you that can really give you that comfort that you need and deserve for an egg retrieval. It would break my heart to know that you couldn't continue your IVF journey simply because the pain of the egg retrieval was a barrier.
Welcome to my fertility podcast, Superhumans.
A space for honest conversations, expert insights, and stories of resilience.
Whether you're just getting started on your fertility journey, facing challenges, or looking to educate yourself, you are in the right place.
We are Dr. Mavis Garcia
and Dr. Wise,
fertility specialists at Markham Fertility Center located in Markham, Ontario, Canada.
Think of us as your biggest cheerleaders. Let's demystify the world of fertility together. On today's episode, Superhumans, we are talking about one of the most common questions that we get asked in clinic almost every single day. Is the process of IVF or egg freezing painful? Now, if you're interested in IVF, please check out our other episodes on this topic. There was episode 14, episode 20, 54, and 58. And if you're interested in learning more about egg freezing, check out episode 22. It's important that we explain that in this particular episode, we're going to be focusing on the beginning part of an IVF cycle or an egg freeze cycle. And they are the same. This is the stimulation phase where somebody is taking medications to stimulate the ovaries and the actual retrieval. So this episode is pertinent to both individuals who are interested in IVF and egg freezing, and we're going to be using these phrases and these words pretty much interchangeably throughout this episode. If you are considering IVF or egg freezing, or already starting or just exploring your options, chances are that you've thought about how much pain that there might be with these procedures. This has probably crossed your mind more than once. So today we're going to break this down for you honestly and clearly. What do the injections actually feel like? How uncomfortable is the process? How uncomfortable are the ovaries during the stimulation? What's the egg retrieval procedure like and how painful is it? What's the recovery like? We're also going to be talking about different types of sedations that people may receive during retrieval and specifically the type of sedation that we use here at Markham Fertility Center. Let's get into it and walk through this step by step.
Yes, let's do that. But before we get into it, I want to take a moment to acknowledge something that is important to us. Pain is a very individual experience. We're not here to tell you that your pain is not real, that it doesn't exist, or that IVF would be completely painless. That is not the case. We don't live in your body. We know that there are many layers to pain. Everybody has different pain tolerance. Everybody has different experiences with pain. And everybody has a different context to the experience of pain. So we want to make sure that as you listen to this episode, no matter where you are on that quote unquote pain scale, you feel validated and that the purpose of this episode is to educate you about the different stages of the IVF or egg freezing process and what is the experience of most of our patients, but your own individual experience is important. And we're not here to minimize that.
I think that that's a really, really important point. The analogy that I always give people, it's like, when you ask somebody about their menstrual cycle or about their menstrual period, some people will talk a lot about breast tenderness. Some people will talk a lot about cramping. Some people will say that they don't have any symptoms, but it is everyone's period. So everybody has a very different lens that they're going to be looking at this and thinking about their pain and how they're experiencing it as they go through this process. What we've tried to put together today is really about most people's average experience to give people a bit of insight into what it's like for the majority of patients who are going through this.
All right. So the first step would be the injections. And this is the part that most people really worry about because, it's not every day that you have to give yourselves needles on a regular basis. During the stimulation phase, during either IVF or egg freezing, you'll be taking hormone injections to stimulate the ovaries to grow multiple follicles that ultimately should contain the eggs. Here's what patients are usually asking me. How many injections do I need per day? How big are the needles? And what do they actually feel like? Well, for most patients, they would take about 1 to 3 injections per day for approximately 10 to 12 days. And the part that surprises people the most is that needles are actually really small. They're similar to insulin needles. They're short, they're very thin, and they're designed for subcutaneous injections, meaning that they go under the skin in the lower abdomen. Many of you know I have done IVF myself multiple times. So I'm speaking from both personal and professional experience that really the needles are not usually something that is extremely painful unless you happen to have a needle phobia, which is something else entirely.
When you're doing these injections, these needles do not need to go near your ovaries and they're not going into your ovaries. That's actually a really common myth we hear. The needle is very small and very short, and they go just beneath the surface of the skin into the fatty tissue that lies right underneath, which has really good blood flow and allows the medication to be absorbed effectively. The medication is actually absorbed and circulates throughout the whole body before it reaches the ovaries. Patients will often ask, if I do the injection on one side versus the other, is that going to cause one ovary to grow more eggs than the other? And that's not true. It circulates around the body before it gets to the ovaries. A majority of patients will tell me that after they've gone through an IVF stimulation, that the injections were actually way easier than they expected.
Yeah, again, from personal experience, I can tell you that yes, there is a sensation during the injection because you're prickling the skin, but it's not sharp or deeply painful. Most patients would say it is like a small pinch. Sometimes it could be some mild stinging from the medication itself, an occasional bruising and the injection site, but overall, it's fairly manageable.
At Market Fertility Center, our nursing teams are going to teach you exactly how to do the injections, and we walk you through everything. You'll have access to explanatory videos that you can rewatch at home while you're doing the injections or while you're preparing for injections. And we also give you a bunch of practical tips for the injections. And again, when you're in cycle monitoring and you can touch base with the nurses and go through different little small adjustments that may improve comfort significantly. For instance, some patients find that icing the area with a little ice pack briefly before can be helpful. Another helpful tip could be rotating injection sites, so using a slightly different location for your injections. I can tell you that most people feel very nervous before their first set of injections, but by the time you get to day 3 or day 4 of the stim, most individuals are feeling confident and feeling like total pros.
Now, let's talk about what is happening internally during ovarian stimulation and what that can feel like. So, have your ovaries respond to the medication? They grow multiple follicles, hopefully, each of them containing an egg. Now, for patients with high ovarian reserve, such as patients that are young, patients that have polycystic ovarian syndrome, or patients that have really high AMH levels, the ovaries can grow quite large towards the end of the stimulation.
So, on average, an ovary is about 3 to 4 centimeters long, roughly the size of a shelled walnut. By the last few days of an IVF simulation, depending on the number of follicles that have grown, it can grow to the size of a plum or even a small orange. And that increase in size can feel like pelvic fullness or pelvic pressure. Lots of individuals will describe feeling bloated or feeling heavy, especially when bending or walking, because it just applies more pressure to that pelvic area. Some patients will say something like, for the first time, I feel aware of the fact that I have ovaries. Certainly, it can be more uncomfortable, especially in the final 2, 3 days before the retrieval, because that's when the ovaries are getting to their largest size, especially as we said in high responders. But this is temporary. After the egg retrieval procedure, the ovaries will gradually shrink back down to their usual size. So, really, when we're thinking about symptoms from stimulation, most people are feeling these symptoms the most a couple days before the retrieval, day of retrieval, and a couple days after the retrieval. It's not necessarily through the whole stimulation.
Yeah, exactly. And this is the point. Patients sometimes ask, can I exercise during my ovarian stimulation phase? And I always tell them, listen to your body. Usually, this is exactly the point, like 2 or 3 days before retrieval in people with high ovarian reserve, where they might feel more uncomfortable. And I would say things like jumping jacks or a lot of pelvic movement might not be ideal, but certainly you could still go for walks and do what feels right to your body at that time.
Hey, this is a great excuse not to do burpees.
Oh my God. I hate burpees.
Everybody hates burpees, but this is an actually medically valid reason.
All right, so let's move on to the next big question and the part that patients are usually most anxious about, which is the egg retrieval. Is the actual egg retrieval procedure painful? Well, the egg retrieval is a short procedure and it lasts usually about 15 to 20 minutes. In this procedure, a thin needle is passed through the vaginal wall under ultrasound guidance to collect the eggs from the ovaries. And I know some of you have seen what a retrieval needle looks like, and it is a very long needle. But let me assure you, the whole thing doesn't go inside. The reason that the needle is so long is because it has to go through the transvaginal probe. So the part that is actually puncturing the vaginal wall to get into the ovaries is about 3 to 4 centimeters. The procedure is done under sedation, meaning that IV medications are used to provide pain relief, reduce anxiety, and ensure patient comfort during the procedure. However, the type of sedation available varies across different fertility clinics.
Let's talk about different types of sedation protocols. In traditional conscious sedation, this is the most common method that is used for egg retrievals in Canada. In this protocol, patients will receive a combo of medications intravenously, meaning through an IV, which typically involves a pain medication like fentanyl and an anti anxiety medication, often like midazolam, through an intravenous. When you get this combo of medications, people will often feel drowsy and relaxed, but you're still pretty aware of what's going on during the procedure. Certainly, patients having this type of sedation may feel some pressure, may feel some discomfort, although pain will be blunted and will be minimized. Most patients will be able to respond to instructions. Like if they're told to do something, they are able to most of the time. Now, patients may have some memory of the procedure, although sometimes these medications can cause a bit of a partial amnesia, so people don't recall actually having the procedure happening to them.
The other type of sedation protocol is the one that we use here at Markham Fertility Center for every single one of our patients, and that is a propofol based sedation, also known as deep sedation. This is something where only an anesthesiologist can provide it, so you need an anesthesiologist present and in charge of administering the IV medications and monitoring the patient throughout the procedure. Propofol is often combined with other pain relieving and anti anxiety medications and typically produces a much deeper sedation. At Markham Fertility Center, when receiving this protocol, you're going to meet with the anesthesiologist the day of the procedure. If you're somebody that has some medical issues like asthma or elevated BMI or any other medical issues, you will have a pre anesthetic consult done prior to the day of the procedure. But if you don't have any medical problems, then you will meet with an anesthesiologist the day of the procedure. And during the retrieval, the anesthesiologist will put the IV and give you the medications, and you're going to be in a much deeper state of sleep. You will be unaware of the procedure and unlikely to remember anything. You are going to feel no pain or minimal pain during the procedure. And you're going to be less responsive, which means that we can't really give you commands to do things. So you're not going to be able to talk to us because you're going to be completely asleep.
It's important to note that from a safety and effectiveness perspective, both sedation methods are safe, well tolerated, and can provide effective pain control. Neither has been shown to negatively affect egg quality, fertilization rates, or pregnancy outcomes. Now, with the first method, the traditional conscious sedation, most patients do very well with traditional conscious sedation, but for some patients, and it's difficult to predict who it may be in some cases, they can still be quite awake and they can still feel quite a bit of what's going on during the procedure. With a propofol based sedation, 99 plus percent of patients are very comfortable and are generally mostly asleep and tolerate the procedure very well. So there is a difference between these two methods.
I agree with you. They're not the same. At Markham Fertility Center, we believe that anesthesia on site is something that greatly differentiates our care because when anesthesia professionals are involved, we're able to really safely treat patients with special considerations. That means that more patients can undergo IVF in a comfortable, controlled setting. At Markham Fertility Center, safety matters, but comfort also really matters. Another thing that I find about the ability to have an anesthesiologist on site is that sometimes, like you were saying before, Dr. Weiss, you just don't know what it's going to be like until you're there. So, for example,
Mhm.
last weekend, I was doing a couple of retrievals, and these were on patients that needed to have an abdominal retrieval or on patients where I needed to push quite hard in order to be able to access the ovaries. And it was thankfully due to the deep sedation of our amazing anesthesiologist that I was able to get every single egg, because I am pretty sure that with another type of sedation, it just wouldn't be tolerated. The amount of pushing that I had to do to be able to safely access the ovaries. And also doing abdominal retrievals can be really hard as well without proper sedation.
Absolutely. There are many patients who would benefit from deep sedation because you're just more comfortable. You're more asleep during the procedure. But there are certain groups where it may be even more important for them to consider deep sedation. For instance, patients with endometriosis. We know that if endometriosis is present in somebody's pelvis, pelvic procedures can be more painful or more challenging due to inflammation, due to scarring or adhesion, whereas the ovaries are usually very close to the vaginal wall and easy to access. In patients with endometriosis, sometimes those ovaries can end up scarred and sort of be somewhere on top of the uterus. And as Dr. Garcia mentioned earlier, we may need to apply some abdominal pressure to bring the ovary down towards the vaginal wall so that we can provide the safest egg retrieval possible. There may also be some increased nerve sensitivity as well and pain sensitization that can make retrievals more uncomfortable for patients with endometriosis. In these patients, deep sedation can really make the difference, as you said, between getting all of the eggs or some of the eggs.
You're absolutely right. Another group of patients that really would benefit from deep sedation is patients with vaginismus. And if you don't know what vaginismus is, or if you experience that and want some help with it, you should listen to episode 45 with Cornerstone Physiotherapy, where we talked about it, as well as some techniques to help with that. Patients with vaginismus experience involuntary pelvic floor tightening, and even a routine pelvic exam like a pap smear can be extremely difficult. So, an egg retrieval without adequate sedation would be traumatic for these patients. This sedation allows the body to relax completely so that the procedure can happen without eliciting further discomfort and further trauma.
Another group of patients for whom deep sedation can be really helpful is patients who have a history of trauma. For patients with a history of sexual trauma, medical trauma, or even severe procedural anxiety, being awake or even a little bit awake during a transvaginal procedure may be very psychologically distressing and may actually prevent them from moving forward with fertility treatments. With deep sedation, we can ensure both physical comfort and emotional safety. At Markham Fertility Center, we really do believe that trauma informed fertility care is essential.
Like we mentioned before, I think every patient can benefit from the sedation, but definitely there's a certain group when it is absolutely essential. Now, let's talk about what happens after egg retrieval. So, after the egg retrieval, you might experience mild cramping, bloating, light spotting, and these symptoms typically improve over the next few days. Immediately after the procedure, you will feel a little bit sleepy for a few hours, and it's very important to ensure that you have a support person there with you that can drive you home. You absolutely cannot drive for 24 hours after having deep sedation. Patients can go home the same day, and most can resume light activity the next day. And recovery is usually fairly quick. For high responder, this could be more bloating for several days. At Markham Fertility Center, our nurses contact every single patient after the egg retrieval procedure to make sure that they are okay and that they feel comfortable and to guide them through any possible symptoms that they are experiencing.
Let's go back to our original question. Is IVF or an egg retrieval painful? Here's the bottom line. The injections, although they can be daunting at first, they truly are manageable. The ovarian enlargement, all those follicles growing in the ovary, can be a bit uncomfortable towards the end. And most every patient will experience and describe this as bloating. The egg retrieval procedure itself, especially at Markham Fertility Center, is not painful because you are under deep sedation. So you are asleep and you are comfy as can be. Physically, most patients tolerate IVF way better than they ever expected to. Now, we do want to make a pause here and talk about something that's very important and we haven't really addressed yet. And that's the emotional side of IVF. We've talked so much about the physical pain and the injections, but emotions for sure play a really big role when it comes to how we feel during an IVF cycle and retrieval. For many patients, the stimulation and retrieval are not physically painful, but the emotional experience can be intense. There's the anxiety that comes during the stimulation and monitoring. There's the uncertainty of the fertilization reports and embryo development when we're talking about IVF. And the waiting can be hard and it can feel like an emotional roller coaster. Sometimes what patients remember most isn't necessarily the physical discomfort of the process, but it's the emotional vulnerability, that emotional roller coaster. We know that this process requires courage. And for us, acknowledging that emotional component is just as important as managing physical comfort.
And we want you to know that if you're scared, that's normal. We are here rooting for you and guiding you along every step of the process. Most patients actually tell us afterwards, I was so much more afraid than I needed to be. As Dr. White mentioned, IVF requires courage, a lot of it, but it should not require physical suffering. So, my biggest wish for you, if you're out there and you are like many of the stories I've heard in my practice of patients that feel that something is wrong with them because they had a painful egg retrieval and they just don't feel they can do it again, know that there's nothing wrong with you and that there are sedation protocols available that can actually make most patients, if not all patients, very comfortable. That's an option for you that can really give you that comfort that you need and deserve for an egg retrieval. And it would break my heart to know that you couldn't continue your IVF journey simply because the pain of the egg retrieval was a barrier. At Markham Fertility Center, our goal is to make sure that this process is as safe, individualized, and comfortable as possible, both physically and emotionally. As always, thanks for listening, and we'll see you next time. And also, I want to give credit to Dr. Maria Hincapié, who has helped us doing the research for this episode.
And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music, Island Memories, instrumental by Descript stock music. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.